Hello, I'm Dr. Eugene Harrington, and on behalf of Dr. Gail A. Maddox, I would like to welcome you to the Historically Black Colleges and Universities Center for Excellence in Behavioral Health, located at Morehouse School of Medicine in the Department of Psychiatry and Behavioral Sciences. The HBCU Center for Excellence serves as a unique center designed to facilitate, develop, collaborate, support strategies, and promote opportunities for HBCUs to address the behavioral health needs of students and foster workforce development. The overall goals of the HBCU Center for Excellence are to, number one, promote student behavioral health to positively impact student retention. Number two, to expand campus service capacity with a focus on culturally appropriate behavioral health resources. Number three, to facilitate best practices and dissemination. And lastly, number four, to foster student leadership and behavioral health workforce development.
Afternoon, each and every one of you out there in webinar land. The title is A Peer Educator's Perspective, the Emerging Door of Successful Peer Education Leadership on Historically Black Colleges and Universities Campus. Now I'll go ahead and introduce our guest for this evening. She is none other than Mariah N. Williams. We're so pleased to have her as our presenter this afternoon. And Mariah is a senior at Florida A&M University. She is studying political science and international relations. She is the current president of Active Minds and vice president of Model United Nations for the 2012-2013 school year. Currently, Mariah serves as a steering committee member for the HBCU Center for Excellence at Morehouse School of Medicine, while serving as a trained behavioral health peer educator at Florida A&M University. Her training and qualifications include BACUS, Active Minds, HIV/AIDS, substance abuse, hepatitis, and question, persuade, and refer, and we refer to that as QPR. Mariah utilized her peer education skills while interning in Bridgetown, Barbados with the United States Department of State. She has a mastered adapting to the cultural differences and strongly believe service learning aids in strengthening needed workforce development skills. Mariah is honored to be a peer educator and embraces her passion to serve others as a gift to others. Her future goals include becoming a diplomat, later as an ambassador, and as an international lawyer. Mariah is also interested in starting a non-governmental organization with emphasis on behavioral health disparities. And with that introduction, I'm pleased to present to you Mariah N. Williams.
Thank you, Dr. Harrington, for that introduction. Once again, I am Mariah Nundy Williams, and let's get started with this webinar. A Peer Educator's Perspective, the Emerging Door of Successful Peer Education Leadership on Historical Black Colleges and Universities. Next slide, please. The webinar goals for today are to define behavioral health, define peer educator, describe the role of a peer educator in addressing behavioral health disparities on HBCU campuses, define behavioral health disparities, describe methods of recruitment and retention of peer educators planning, implementing, evaluating, and celebrating behavioral health campus activities, the benefits of being a peer educators, and workforce internship opportunities, and last but not least, to describe national peer education training and resources. Next slide, please. For peer education, for behavioral health peer education, you always need great peer educators. So here are some fun characteristics of peer educators. They are leaders, advocates, collaborators. They always set standards. They are approachable. They have integrity. They set good examples. They're credible. They get along with others and are well received. And a peer educator always is a good listener, never judgmental, and is always open-minded. Next slide, please. Understanding the role and importance of behavioral health peer educators on historical Black colleges and universities. Next slide, please. What is behavioral health? Behavioral health refers to a continuum of services for individuals at risk of or suffering from mental, behavioral, or addictive disorders. As a discipline, it refers to mental health, psychiatric counseling, and addictions treatment. Next slide, please. Behavioral health disparities. Next slide, please. About 25 of all U.S. adults have a mental illness, and nearly 50% of U.S. adults will develop at least one mental illness during their lifetime. In 2011, close to 14 million African Americans had some form of behavioral health disorder. Disparities exist in both access to and quality of care. There are barriers to treatment such as stigma, culture factors, underutilization of services, and lack of familiarity about resources. Next slide, please. The prevalence of serious mental health conditions among 18 to 25-year-olds is almost double that of the general population. The percentage of Blacks between the ages of 18 to 25 years old receiving treatment for serious psychological distress, also known as SPD, was 7.5% compared to 15.2% of whites in the same age group. College students, also known as young people have the lowest rate of help-seeking behaviors. Next slide, please. Suicidal thoughts and behavior. In 2010, an estimated 8.7 million adults, which in the chart shows 3.8%, aged 18 or older had serious thoughts of suicide in the past year. The percentage of adults having serious thoughts of suicide was highest among persons aged 18 to 25, 6.6%, among adults aged 18 or older, 2.5 million, which is known as 1.1% in the chart, made suicide plans in the past year. The percentage of adults who made suicide plans in the past year was higher among persons aged 18 to 25, which is equivalent to 1.9%. And this is essential because students between the ages of 18 to 25 years old attend colleges and universities. Next slide, please. The percentage of adults with co-occurring mental illness and substance use disorder in 2010 was highest among adults aged 18 to 25. Next slide, please. Rates of alcohol and other drug use on HBCUs. African American students drink less frequently and in smaller quantities than any other racial or ethnic group on campus. African American students at historical Black colleges and universities drink approximately the same rate as African American students at predominantly white institutions, also known as PWIs. Black student athletes drink less alcohol than white student athletes do, and Black athletes are more likely than their white counterparts to abstain from alcohol. Students at HBCUs use marijuana less than students at predominantly white institutions. Next slide, please. SAMHSA, 8 Dimensions of Wellness. SAMHSA has an 8 dimension of wellness, which is a balance for everyone's wellness and health. They include emotional, financial, social, spiritual, occupational, physical, intellectual, and environmental. Individual differences is also placed on SAMHSA's 8 dimension of wellness as a concession. So, for example, emotional wellness is defined as developing skills and strategies to cope with stress. This is a resource that peer educators can use. Behavioral health peer educators in their role in addressing behavioral health disparities on HBCU campuses. Next slide, please. What is the role of a behavioral health peer educator? Behavioral health peer educators is an advocate for prevention and wellness of their peers. They are trusted by peers to provide reliable answers and accurate information, and they have hands-on knowledge that enables them to interpret the report from a different perspective. Next slide, please. To continue, they will assist university administration in reducing discrimination and behavioral issues. They input and the input that they implement into the campus will help prevention programs become more successful. Next slide, please. Why are behavioral health peer educators useful? They are student leaders and they are role models. They generally student leaders are selected by their peers, which suggests a certain level of trust between the peer and the student leader. Student leaders are also able to contextualize issues to their peers in a more accurate manner by providing contemporary reflection. Next slide, please. To continue, they assist campus-based student services with events and projects that promote behavioral health. Also, inside of behavioral health, you have substance abuse and mental health, awareness, and wellness. They provide effective strategies in addressing college, drinking, and other destructive behaviors. Next slide, please. They are young professionals who take confidentiality serious and are passionate about saving lives through preventive measures. This is essential because when it comes to confidentiality, you want to make sure that students are certain that behavioral health care educators have those characteristics of leadership that they should obtain. Next slide, please. Peer education services. Faculty will assist with determining the desired number of peer educators needed based on population of campus size and office space. Peer educators are adopting into environments and gaining the peer education leadership skills they need to assist the counseling services or campus services. Peer educators not only represent the university, they represent the counseling services and can determine whether the students will feel comfortable receiving help or not. Peer educators represent campus wellness. Behavioral health peer educators do as well. Collaboration in addressing behavioral health disparities on HBCU campuses. Next slide, please. Campus organizations are essential to the success of a university. Every university has a lot of organizations and has student activities office. So, and all organizations, including especially on HBCU campuses, the sororities and fraternities are important to the success of the campus in terms of programming. This is because they have events that promote student involvement. They demonstrate leadership for prospective students participating in their activities. So, for example, a lot of Greek organizations are very important because students idolize them. They see them, their initiatives in their organization are to help both campus community and the outside community. Continue, please. Recruitment and retention of peer educators. Next slide, please. The who, what, when, where, and how for recruiting peer educators. Next slide, please. Now, as you've seen on the previous slide, marketing and networking are the main two ways to get yourself out there about what you're trying to do. Now, in terms of marketing basically is selling yourself to anyone. So major ways that students can do this is through social media, which the most popular social media networks are Facebook, Twitter, texting, and blogs. Utilize university newspapers, the university emailing systems, student activity lists of presidents of the organization. This is very, very important. for collaboration reasons, student government, association, and student cabinet. And most times, student cabinet is not associated with student government, so that's why I put that on there separately. So just check your university. Next, please. Also, university dorm rooms, parking lots, off-campus housing. The university off-campus housing is really important because a lot of students don't have on-campus housing, and especially those who are sophomore years who are still possibly prospective members. So that's what us at Florida A&M University did. We took our bicycles and we went to off-campus housing near campus and passed out and marketed our events. Please take into consideration that freshman welcome week is a great week to market during homecoming time and right before students leave to go to spring break. So when they come back, if you have an event, your event will be known about. When networking, always when networking, you have to be very concise. Understand what responsibilities you have will have to be done so you can talk to the right people and get things said correctly and marketed correctly. Next, please. Have business cards available for communication purposes. Like I said previously before, when it comes to marketing, when it comes to networking, talking to people, make sure that you have the available resources for them to contact you. Always sound knowledgeable and enthused when speaking to others about peer education activities. The best way to do that is to be yourself. Sell yourself, sell your story. Why are you doing peer education? Why is it important to you? And always be honest and give out the right information concerning it. If you do not know something, always tell people, hey, I don't know right now, but I will get back with you as soon as possible. The qualities of a peer educator include, next slide please, perspective. Prospective members, behavioral health peer educators, differ from depending on your campus. You know what you're looking for. You know what students you would like to have, and as a student, you know what potential other peer educators qualities they should have, and you base what prospective members you want off of this. Next, please. Positive. You want positive peer educators because they always leave optimistic possibilities and opportunities for students. Positive peer educators always have a great atmosphere, and they always get things done. Next, please. Professional. Your professional peer educators come with, when it comes time to talk to administration about certain issues, the confidentiality about helping counseling services, your professional peer educators come in because they know how to lead effectively and help other peer educators. Next, please. Your popular peer educators are your brands. Sometimes your peer educators, behavioral health peer educators, may not have as much training as possible, but your university king and queen, homecoming, oral court, you get these students involved and they're the face of peer education, and they also implement hard work. So popular students are also good for marketing and networking and branding. Next, please. Retention of peer educators. Retention of peer educators is essential for the continuation of wellness. Freshman students, like I said before, freshman week is a very good week only because freshmen stay on campus for 4 to 5 years. So they have more years on them. And they can be trained by the seniors and the juniors. Graduate students are very important too because I believe graduate students they balance out peer education. So they're the middle person between the project director or coordinator and the student peer educators. Next, please. Peer educators planning, implementing, evaluating, and celebrating behavioral health campus activities. Next slide, please. Effective planning. Effective planning implements visualizing activities and setting calendar dates. Knowing what's going on, collaborating with existing student groups, and budget and fundraising for events. Next slide, please. To continue, you must know who you want to participate in your event, abide by administrative rules and regulations, determine location for the event, and advertise for the event around campus. Next slide, please. Implementing activities. Always consult with project director, submit needed paperwork in advance, meet with the administration about rules and regulations, communicate with co-hosts to plan order of the event. It is really important that you submit your paperwork in advance because sometimes things go wrong, weather goes bad, and some things are uncontrollable. But you want to make sure that when implementing activities, that everything that you want to implement is done. Next, please. You want to distribute promotional information to your advisor or project director so they can approve it. Then you want to get it approved by student activities. Then you want to distribute it. And you must acknowledge special guests and partnering organizations by giving them certificate of engagement in your activities and thanking them. So it can encourage not only them, but they can go and spread the word to other organizations. Next slide, please. Evaluation outcomes. Create a survey for participants, record demographics, request project directors' feedback, and be candid about audience response. The reason I put request project directors' feedback is because most of the time you have grants, and what you want to do is you want to make sure that you're getting the correct numbers you need, and you want to make sure that everybody is on the same page. So you are, as a student, you want to do things, but your project director, in terms of the training and the profession that they have, you want to make sure that because you're representing them, that everything is done according to the proper way. Next slide, please. Celebration time. Yay! Debrief with other organizations and plan to keep behavioral health popular. Review evaluations with project directors and campus counseling services, and let's celebrate our accomplishments. It's always good to have evaluations with the project directors, as I said previously before, and it's only because you want to continue to, spread around campus the positive, impact that pre-education has. And it involves everyone on campus. So if you're passionate about it and you're very honest about it, and you celebrate all the good things, you acknowledge the things that you approve on and celebrate the good things, and you will really love planning. Next, please. The benefits of being a peer educator. Some of the benefits of being a peer educator, you learn public speaking skills because when you're out tabling, you have to speak to people. And with that comes, a lot of things. Internships and workforce development opportunities. If you're a behavior peer educator and you work within a counseling center or student activities, you get the benefit of working in an office. Next, please. You become responsible. So the benefits of being a peer educator in terms of their interpersonal qualities, you learn responsibility, you become cooperative, you are a good example, you have a caring attitude, trustworthy, you become knowledgeable about topics, and you set positive standards. Next, please. Peer educators and workforce internship opportunities. Next, please. The previous slide, I talked about the interpersonal qualities, and some of those are implemented into why it evolves into how you get your workforce development opportunities. Peer educators will assist students with leadership development skills necessary for workforce opportunities. When students become a peer educator, they are more than just a student. They become an ambassador for wellness on their campus. And students will be able to effectively lead and properly follow while encouraging others. Next slide, please. Communication, cooperation, accountability, and interpersonal skills are some characteristics acquired from becoming a peer educator. Counseling Center exposes peer educators to domestic violence, veterans assistance, sexual assault, and other important circumstances or situations that are involved in being a wellness peer educator or behavior peer educator on HBCU campus. Next slide, please. The HBCU Center for Excellence provides leadership and social media trainings for leaders, students will realize that behavioral health can be utilized in various ways for many occupations. Historical Black colleges and universities should engage in this millennium exposure to behavioral health initiatives on HBCU campuses. Next slide, please. How can behavioral health be applied? Behavioral health principles can be applied in practice by a variety of disciplines, including psychologists, social workers, counselors, and other mental health professionals. Next slide, please. Some internships that you can receive or you can apply for when you're a behavioral health peer educator or peer educator include Center for Disease Control internships and fellowships. They are the National Undergraduate Summer Public Health Program, Future Public Health Leaders Program, and Dr. James A. Ferguson Emerging Infectious Diseases Fellowship Program. Next slide, please. The Office of Minority Health Internships. Some of them include Presidential Management Fellows Program and the National Institute of Health Research and Training Opportunities. Next slide, please. SAMHSA internship and fellowships include, some of them include Social Work and Public Health Practicum Program, CSAP Prevention Fellowship Program, and Minority Fellowship Program. Next slide, please. U.S. Department of State internship program includes Student Career Experience Program, Student Internship Program, Summer Clerical Program, Workforce Recruitment Program, and the Global Health Fellows Program, which is under the program which is under the USAID. I had the opportunity for doing the student program, which was really awesome. National Peer Educators Training and Resources. Next slide, please. Next slide. National Institute of Mental Health. Their vision is a world in which mental illness are prevented and cured. I'm sorry, that's their vision. Their mission is also to transform in the understanding and treatment of mental illness through basic and clinical research paving the way for prevention, recovery, and cure. Next, please. Active Minds organization. Active Minds organization wants to empower students about the prevention of mental health. So, some of their initiatives and national programs include Send Silence Packing, National Day Without Stigma, National Stress Out Day, and they have Eating Disorders Awareness Week. Next, please. Bacchus Network. Next, please. The Bacchus Network is a university and community-based network focusing on comprehensive health and safety initiatives. One of their initiatives is to promote and disseminate research and effective strategies that better help campuses and communities address health and safety issues. Next, please. SAMHSA, Substance Abuse and Mental Health Services Administration, is an awesome resource. They provide leadership and devote its resources, programs, policies, information, and data, contracts, and grants toward helping the nation act on knowledge that behavioral health is essential for health, prevention works, treatment is effective, people recover from mental and substance abuse disorders. Next, please. And this is information if anyone wants to browse the website, SAMHSA, or email the organization about anything. It's a really good resource. Next, please. Crisis, Veteran Crisis Line. The number for this is 1-800-273-8255. I definitely know on colleges and campus it's hard sometimes to reach those who are in ROTC, but if you send out a warm invitation and give them this information, it will be awesome and helpful. The references, this is a source. This is where I got all my information from. So if anybody wants to refer into more information about especially the workforce and internship opportunities, please check out my references. Now, so if anybody has any questions for the final, please let me know. But before then, we're going to let Dr. Harrington say a couple words.
Thank you, Mariah. And again, on behalf of Moore School of Medicine, the HBCU Center for Excellence in Behavioral Health, we're pleased to bring you this wonderful webinar presented by Mariah Williams, a peer educator's perspective, the emerging door of success, peer education leadership on historically Black colleges and campus. She did a wonderful job, and we want to thank her so very much for participating and presenting us with this wonderful information. Thank you again, Mariah.
Thank you. Now, I hope this information was resourceful for everyone. And please, if you have any questions or concerns, please make sure you contact me at any time. Thank you.
The HBCU CFE would like to acknowledge the creative and innovative talents of students and their faculty, staff, advisors, as well as our SAMHSA project officers and steering committee members and the rest of the CFE team.